U.S. Congress and American healthcare, a volatile match that's been defined by poisonous politics recently.
We need a combination of political courage, productive engagement, and frankly, mutual goodwill that's been missing so far.
The issue exploded in March when House Republicans failed to repeal the Affordable Care Act, a policy move that, if passed, would have left 24 million Americans without medical coverage. People like Christina Mackin, a pregnant mother in 2016 who had a horrific healthcare crisis.
I developed serious and rapidly advancing complications, which, if untreated, results in death for both mom and baby. After several days in the hospital, I went into organ failure.
Fortunately, Christina and her daughter Frankie were covered by the Affordable Care Act, a plan that protected them from financial ruin.
My 2-week hospital stay would have demanded all of the money we had saved for me to take a 6 months of unpaid maternity leave. By Frankie's 8th day in the NICU, we would have exhausted the entirety of our retirement savings in our IRAs and our 401k accounts. By day 20, her medical bills would have exceeded the potential amount of money we could recoup from selling our home. And by day 25, we would have been forced into medical bankruptcy.
As Christina and her daughter continue to recover, partisan walls and congressional cliques may soon dissolve, as both parties finally seem ready to sit down in bipartisan fashion and look for ways to improve the Affordable Care Act and the medical coverage system as a whole.
A number of Republicans have approached me and other Democrats to talk about ideas. We can work on reducing premiums. We can work on reducing deductibles and out-of-pocket costs. We can create conditions that favor competition among health care plans in every sector of the market. We can bring down prescription drug prices and many more.
As Capitol Hill comes up with a definitive timetable for improving health care, middle-class Americans like Christina Mackin hold on to hope, and pro-union politicians praise recent progress in Washington.
After 7 years of noisy partisan wrangling, I can confidently stand here today and say there is a path going forward to strengthen our health care system.